All right, let's chat about chronic Lyme disease. A topic very well not understood, but also not very well publicized. A lot of people do have some type of chronic Lyme, if not themselves or a family member, and especially here in the Northeast. So I want to talk about some of the ways to prevent, some of your acute presentations, and also the more important subject of chronic presentations. So, just as review, prevention, try and prevent any tick bites by, you can use insect repellents, good clothing, avoid areas of high brush and leaves, use heat to kill, so make sure you wash and dry clothes with hot water and put them in the dryer, hot showers, do examinations. The big one for a lot of people is pets, so either prophylactically treat your pets, also examine your pets, make sure that there's nothing on them if possible. That's very hard to do, but do the best you can. All right, acute tick bites. So I would say majority of bites are probably not aware. People are unaware of their tick bites. Usually 60+% of individuals with chronic Lyme never knew that they had a tick bite. Typically because they would have gotten treated earlier. But acute tick bites, you want to remove the tick fully if you see it there, and then identify that it is a deer tick. Save the tick. Now everyone throws it out. Save the tick, put it in a little plastic bag, send it out for analysis, especially if it's been in you for a long period of time. I went hiking yesterday. I found the tick late at night, a day later. It's been on for at least 24 hours or later. Definitely need to send it out for testing. You can even just save the tick in a tick bag or a little baggie or whatnot, and you can say, I will send it in if I have to, if I have symptoms or whatever, which is, not the greatest of ideas. But that testing is cheaper and more accurate than for us to test you. So if it comes to it, testing you is usually a month after your tick bite, because it takes a month for the infection to infiltrate the system and the immune system to kick back. And that's what we're testing, the immune system's response to the infection. So it takes a full month. At that point in time, you've already had an infection in you for a month. Now there is specialty T cell testing, which you can do immediately, but it's in its infancy, so its accuracy is limited, but it's out of pocket and it's specialty testing, so not very commonly utilized. So sending the tick in for testing is definitely your best bet. Now, if you develop any bullseye rash or you have any new symptom onset after a tick bite, you have an infection and it needs to be treated. Typically, treatment prophylactically is, it varies. There's no standard, truly. New protocols are a day of doxy. Typically, it was a 2-week protocol of doxycycline. But I recommend 2 to 6 weeks of doxycycline, depending upon the patient's circumstances. So if there's a bullseye rash present, if it's a deer tick, if there's new symptom onset, if the tick testing is positive, and treat up until resolution. So usually that's at least 3 to 4 weeks, sometimes longer if the symptoms persist. So up to 6 weeks of treatment. After 6 weeks of treatment of doxycycline, you want to either rotate antibiotics, switch off treatment, or do something different, typically. Now, types of infections that ticks carry. In the next slide, you'll see more of a demographic, but as you can see here, there's just a few listed. Now, Lyme is your most common, Borrelia, but Bartonella, Babesia, Ehrlichia, Anaplasma. There's just a long laundry list of infections you can get. So you can't, and it's not just bacterial. Sometimes there's parasites, sometimes there's viral infections. So testing appropriately is important. So here's a demographic that shows the types of ticks, and so be cognizant of the deer ticks here and here. You can see how many infections are associated with those deer ticks. The locations are a little outdated, the demographic of where they're located, because they spread nationwide, they spread worldwide, and so these infections aren't located to a location or isolated to a location, they're all over. But these ticks are the ones that are the most common for carrying infections, and you see how many are associated with those black deer ticks. Now, symptoms associated with Lyme disease. So here you see early Lyme or acute Lyme versus chronic Lyme or long-term Lyme. Now, as you can see, early Lyme is more recent onset, generalized flu-like symptoms: fatigue, headache, fever, and sweats, chills, pain, joint pains. That's the common any infection, right? The immune system's kicking in and causing some symptoms. Chronic Lyme is going to be symptoms associated with different body parts, because Lyme has burrowed into deeper portions of the body. So you're looking at muscle and joint pains, you're looking at neurologic signs and symptoms because it's gotten deeper into the central nervous system. It's affected hormones, it's affected your immune functions, it's affected a lot of nerve pathways. So you're seeing a lot of other symptoms, not just your acute fever-like symptoms. Now, I usually have my patients do an MSIDS questionnaire. It's formulated from Dr. Horwitz, who came up with this point-based system that indicates how symptomatic you are and how likely tick-borne disease is. And so that's a great place to start for baseline testing, and that would indicate whether or not chronic Lyme disease is indicated. It's not perfect, but it's a good place to start. It's free, and it's a place that can indicate that additional blood work is worth doing. It's also great for monitoring symptoms over the course of treatment. So initially you have a score of 80, and then over time you want to see that score drop as your symptoms reduce. Now, what's really interesting is you look through this list, you'll see a ton of symptoms, and they're so widespread. So Lyme symptoms, Babesia symptoms, Bartonella, here's just a few. Now, this list is not exhaustive either, so you can just see how many different ways that these symptoms can manifest. And anyone who's got symptoms that are unexplained, who've got chronic presentations, who've got basically something that can't be well identified, you should look for Lyme or tick-borne disease in general, because there's so many different ways they present, and it's so common. So here's just a cool list of some of our more notable symptoms associated for each infection. Now, here's a really important takeaway when it comes to testing. Conventionally, there is, like we talked about, testing at the 1 month mark after a tick bite. That's a relatively okay test then. 1 to 3 months ish to 6 months, that accuracy is decent. After 3 to 6 months, it's very low accuracy. The testing was designed as more of a clinical, more of a research-based test, not really a diagnostic test. And so the Western blot and the antibodies associated aren't great testing strategies. They're low accuracy, especially in chronic disease patterns. So people who get tested 6, 8, 10, 12 months out after a tick bite and it's negative, I can't fully rule that out as it not being there, just that it's not showing up on the testing. Now, there are specialty tests which people who have long-term symptoms, I advocate going this route because it has better accuracy. Here are some of the companies listed: IGeneX and Vibrant. In my mind, IGeneX is the gold standard from what I've seen, but Vibrant is right there with them. So, but there's a lot of good options. Some labs are better than others in some areas, so I use all of them depending upon what is indicated. But people don't know that these specialty tests exist. A lot of people don't know, and they are out of pocket, which is the downside, but they are going to explain and diagnose you appropriately, explain the symptoms you're experiencing, diagnose you well, and that way the treatment can actually be well implemented. A lot of people, even if they get a positive Lyme test on their Western blot on a conventional testing, they're not looking for other co-infections. They're not looking for any other problems or any other illnesses. And so people get treated and they might have some improvement, but they're not getting full resolution because there's other infections at play that need to be addressed. Or they got Lyme testing and got ruled out for Lyme because their test showed negative, but really it was there, just the accuracy of the test wasn't there to show a positive sample. So conventional treatments. Now this is where you start seeing variance in treatment protocols depending on the provider and the type of provider you're seeing. Typically oral medication is administered as antibiotics. Doxycycline is the go-to. It's the most common by far, but there's a lot of options. And so what you have to consider is what type of infection is at play. Is it a parasite? Is it a virus? Is it something that needs to be addressed specifically? And then where is it located? Do I need an IV or oral antibiotics? And for most people, oral is probably sufficient. But in some unique circumstances, IV antibiotics may be more indicated. Now, depending on your provider, there might be 2 to 3 medications needed at once. They could be pulsed back and forth over months to years, and it's all varying upon your tolerance and the need for the medication. Now, there are 3 types of forms that Lyme come in: cystic, cell wall, and intracellular. And all 3 of them need different types of treatments in order to be appropriately targeted. So as Lyme burrows into the tissues, because it's a corkscrew, so think about a corkscrew on a bottle of wine. As it burrows into the tissues, after 3 or 6 months, it becomes less commonly found in the blood, hence why you're getting less of an immune response and less of a positive test. But it can cause more symptoms in the muscles, in the tendons, in the tissues, in the central nervous system. And you need different types of treatments to get into those different areas of the body. And so having a different rotation of medication or treatments is sometimes required. But over the course of months to years, to have the high-dose antibiotics prescribed can be very taxing. And so a pulsed strategy has been implemented by a lot of practitioners recently, and it had good success. So you kind of do a few days on, a few days off, or a few weeks on, a few weeks off, and that varies depending upon your tolerance. So lots of conventional options, both from a very standard cliche standpoint: 2 weeks doxycycline, 1 month doxycycline, or a very unique kind of strategic way of pulsing and combination medication. Now, alternative treatments, I find that these are just as effective for chronic Lyme if well utilized. Herbal tinctures, so some of the more common companies on board here: Byron White, Beyond Balance, Cowden and Bruner. Those are all very common herbal tinctures, but there's many more that utilize combination herbs to treat Lyme. I really like these because they're really well tolerated, they're very effective, they can be used long term, they treat lots of the forms of Lyme and different types of infections. So there's some crossover for Babesia, which is a parasite. So I love using herbal tinctures in combination with other therapies, maybe antibiotics, maybe other therapies. I've also found really good success with other treatment strategies like hyperbaric oxygen, which is saturating the body with oxygen, IV therapies like vitamin C and ozone, which are very antibacterial, antimicrobial, glutathione, very antioxidant based, peptide therapies. There's a ton of ways to approach it, and so using a combination of strategies can be very effective, especially when done well. It's very well tolerated, so not only are you treating the infection, but you're not getting the side effect profile of just high dose medication. And then you also obviously want supportive therapies as well. So things, obviously, the foundations of sleep, diet, exercise, hydration. If you don't have those on board, you're not going to get much success in any type of treatment. I've also seen a lot of really good success with structural work, massage or PT or acupuncture, hot and cold therapies, infrared saunas. The reason for that is that the tissues harbor the bacteria, and so if you're able to structurally move those, then you're able to have good success getting them out into the bloodstream where they can be treated more effectively. Um, every time, actually, I had a patient, every time that they got a massage, they'd have a flare in their symptoms, and they couldn't figure out what the problem was until they were diagnosed with Lyme, and it made complete sense that they were pushing the bacteria into the bloodstream, and the body was reacting to it. So I think it's a good idea to get the structural work. You need the right therapies on board to treat the infection once it's out into the bloodstream. And then supplements on top of it can be very helpful to support the immune system, support the body, support the symptoms going forward, and vitamins and enzymes and homeopathic medications. There's lots of different supportive strategies. So when you think about all of the options in regards to treatments, there are endless combinations. How I choose my treatment strategies depending completely upon the person and their circumstances, what they tolerate. Also, the logistics. Are they able to come in for IVs consistently? Are they able to afford IVs consistently? Are they able to tolerate medication? Do we have to do something more severe depending on their symptoms? How invasive is this? What other symptoms are they experiencing that may be other disease patterns? Are they toxic because of a mold or heavy metals or something like that we need to address for? So my principles are pretty generic, but my treatments vary drastically. And so in order, this is the way I approach Lyme disease. You want to support the body's function. That's your basic foundation. How do we support body's function? Sleep, hydration, diet. Get the body functioning optimally first. Number 2, support the immune system. The immune system's doing most of the work. Don't rely on the treatments to do the work. Let the body do most of it. And that's the reason why most people who have exposure to Lyme don't have symptoms. You hear those stories all the time. Hunters go out, they get tick bites, they get 2 or 3 a year, no symptoms, no problems. Or other people too, not just hunters, but because their immune systems are tolerating the infection, as it should be. But if you're susceptible for some reason, then you can end up with a manifestation of the disease. So we have to get our immune systems on board first. That's the most important priority. Support the body's inflammation. So anti-inflammatories are really helpful. They're also symptom management. Once you have that on board and the body's functioning optimally as best it can, your immune system is supported, you're treating the inflammation, you then consider additional drainage, lymphatic detox, and binders. These have to be implemented first, because when we start treating the infection directly and killing off the infection needs to be detoxed out of the body. If it's not, it will end up as a Herx reaction, which is basically a die-off of the infection at a rate the body cannot tolerate. And you end up with an accumulation of symptoms. This is what low-grade sepsis is, where people get sepsis, they have accumulation of basically systemic bacteria in the bloodstream, and it ends up killing them. This won't kill you, but you'll feel miserable. Your body will feel toxic when you're killing and you're herxing. So you need to be able to drain and detox. So binders are great, lymphatic drainage, supplements can do this, hydration is obviously really important here. Once that's on board, you can start killing. Now the killing can be antibiotics, it can be herbals, it can be IVs, it can be so many different therapies, but it has to correlate to the actual infection. That's why the testing is important. Now, the other big component that people miss often is biofilm treatments. When you get chronic bacterial infections, or almost any infection that's chronic, that is going to form a biofilm, which is basically a home for the infection, and it's an encapsulated home that you can't get inside unless you break down the home, and that way you can treat the bacteria, but you can't treat the bacteria until you break down the home. And so people often will get let's say symptoms of a year. They'll go get finally diagnosed for Lyme, and they'll start treating with antibiotics. 6 months later, they've done a lot of rounds of antibiotics. They are finally feeling somewhat better. They get 4 months of resolution after antibiotics are discontinued, and then it re-flares with new symptoms or reoccurring symptoms. They go back on antibiotics, and they do this repeating cycle over and over for years. And the real concern here is what biofilms are harboring that bacteria, where you have reduced the infection but haven't eliminated it. And so biofilm therapy, or usually enzymes of some sort, help to break open those biofilms to eliminate more of the infection, and that way you can have long-term success. This also raises the question: is, do you always have Lyme once you have Lyme? Probably. You probably also already had it with your chance of exposure here in the Northeast. There's a high likelihood just living here a few years you had exposure to Lyme, unless you're really living isolated. But chances are you're going to be exposed. So what you have to do is consider the immune system's ability to tolerate the infection. What we're trying to do with chronic Lyme is reduce infection to a certain standard and raise immune function to a certain standard, so that not only are you tolerating the infection, you don't have a chance of reoccurrence even if treatment is removed. Where most people right now are sitting, who are symptomatic, have low immune function and high infection. So both treatments are utilized in order to really have success. Really supporting that immune function and then reducing the infection. And that's where biofilm therapy can really get most of the infection resolved. So, in summary, always use caution and prevent the chance of a tick bite. That's the key. Prevent if possible. Once you do have symptoms, whether it's acute or chronic, test well. Start preventative strategies. I do recommend prophylactic antibiotics. I think they are a lesser evil than long-term sequelae of an infection. I think that it's easier to recover from that than it is to recover from the infection manifesting. When you do have chronic Lyme, you want to treat to resolution. Always treat to resolution. Don't just treat for a 4-month protocol because it says 4 months. Monitor your individual symptoms. They should resolve. And then support the recovery process. Support the immune system through the process, and support the body going forward so that you don't have chance of reoccurrence. And so when you're dealing with a chronic Lyme situation, you want to really consider a lot of variables. That's why it's important to have someone on board who knows what they're talking about, who has studied this, and who has a good understanding of your situation and how to monitor you. Because there are lots of protocols out there that just like generically take 6 months of this protocol and everyone should get better. Well, that's just not the case, because some people are dealing with other things like GI infections or parasites or heavy metals or mold, and they need to deal with those in addition to the chronic infection. And it could be the reason the immune system is suppressed in the first place. And so understanding the details and the nuances of the stepwise process and when and what to implement is really important. But the good news is there's lots of good therapies that are all successful. So there's a lot of roads to Rome. You just have to know where Rome is and how to get there. So I hope this was helpful, and I hope it was informative. But know there is good hope and there is good treatment out there. Love to answer any questions about this. Feel free and send me a message at Roots Medical Center. You can send an email. You can give me a call. My contact information is available. So we'll hopefully that leaves you in a good place. And if you're questioning it, start with the questionnaire, the MSIDS questionnaire, and that can be a place for you to start. All right.